Endocarditis is the inflammation of the internal lining of the heart. We have an important criteria which is called the modified Duke's criteria for the diagnosis of the endocarditis, which is a fatal disease. So we are going to describe this criteria, the modified Duke's criteria. How we can diagnose endocarditis with this criteria. So the criteria can be pathological criteria, and it can be major and minor criteria. Major and minor criteria, which will be discussed one by one. Now, how we can apply the Duke's criteria first? How we can diagnose it? Diagnosis on the basis of the major and minor criteria. If we have pathological criteria, then the endocarditis is diagnosed. We will discuss it further. Now we write 1, 2, 3, 4 and 5. We cancel out the 3. For 1, we say one criteria, that is the pathological criteria. When we have the pathological criteria, we diagnosed endocarditis with this one criteria. Number 2, two major criteria. If we have 2 major criteria, then the endocarditis is diagnosed. Now we are coming to 4, 1 plus 3. 1 major criteria plus 3 minor criteria. 1 major plus 3 minor criteria. 5 plus 0, 5 minor criteria. If we have 5 minor criteria, we can diagnose endocarditis. When the 5 minor criteria are fulfilled, the endocarditis is diagnosed. So we want to discuss it further in detail. First, we want to discuss what is pathological criteria. What is the pathological phenomena? Pathological criteria is based on the histological finding, which we can get during surgery or during autopsy. It is the pathological criteria. We get a pathological tissue during surgery or biopsy. We examine it under microscope. That is the histological or histopathological examination. We can find bacteria, inflammatory cells. These tissues can be vegetations. There can be abscess. It can be valvular tissues. And it can be embolic tissue, the emboli. Now we are going to discuss the major and minor criteria. What is major criteria and what are the minor criteria? For major criteria, we have 2. One is the culture finding and one is the echocardiographic findings. So the major criteria, first we are discussing the culture findings, which we mean blood culture. When you have positive blood cultures, that is 2 positive blood cultures, and we get typical organisms in the form of streptococci or Haecki group of bacteria. Streptococci and the Haecki group of bacteria. So this is the one criteria, the major criteria, which is fulfilled. The other major criteria this is B. The other major criteria is the persistent bacteremia. If we culture the blood more than 12 hours apart, at least 2 cultures, and we get bacteria but non-specific bacteria, then another major criteria is fulfilled. Non-specific bacteria. Now the third major criteria is serology of certain bacteria like Coxiella, Bartonella, Chlamydia. Positive serology of certain bacteria. Coxiella, Bartonella, and Chlamydia. The fourth criteria is genetic assay, which we haven't mentioned it. So the D will be the genetic assay. Now, after the major criteria, which we discussed here, the positive blood cultures, and now here we have the endocardial findings through echocardiogram, echocardiographic findings. Evidence of echocardiographic findings of certain pathologies. Like you can see emboli, we can see vegetations, we can see new murmur or regurgitation. Evidence of positive echocardiographic findings. When we do echo of the patient and do positive findings in the form of these abnormalities which we discussed. They can be vegetations, it can be abscess, it can be dehiscence of the prosthetic valves because of the inflammation of the endocardium. It can be valvular regurgitation, or we can get a new murmur on auscultating the heart. So this is another major criteria. So we have blood cultures, assay, serology, and evidence of echocardiographic findings. Now what is the minor criteria? We discussed that one major plus 3 minor criteria. It fulfills the criteria, the Duke's criteria for a diagnosis of the heart. One major, 3 minor criteria, or if we have 5 minor criteria without major criteria, still we can diagnose the endocarditis. Now what are the minor criteria? Predisposing heart conditions, fever more than 38 degrees, vascular and immunological findings. We have the predisposing heart conditions, heart pathologies which can be congenital or acquired, or if a patient is IV drug user, he can get endocarditis. Now the other minor criteria is microbiological evidence. We have certain bacteria, but they are non-specific and they don't fulfill the major criteria. Third one is fever above 38 degrees Celsius. And the fourth will be vascular and immunological phenomena, which are very important, very interesting during clinical examination. The vascular phenomena and immunological phenomena. We will discuss it in detail with some diagrammatic representation for easy understanding. So, what is the vascular and immunological phenomena? And these can be the positive findings during clinical examination. They're very interesting. Very interesting clinical findings. So what can they be? It can be splenomegaly. It can be clubbing. There can be splinter hemorrhages, which are minor hemorrhages under the nails. There can be Janeway lesions, which are present in the palms. They are hemorrhagic spots, which are painless. And what are the immunological phenomena? So we discussed the splenomegaly, the clubbing, splinter hemorrhages, Janeway lesions. These are the vascular phenomena. Now, ossular nodes. They are hemorrhagic nodes, and these are Roth spots. So ossular nodes are present in the finger pad, and Roth spots are present in the retina, hemorrhagic spots. Ossular nodes are tender, and there can be glomerulonephritis, inflammation of the nephrons, inflammation of the glomerulus, or we can say inflammation of the kidney. Now, we are going to discuss the vascular and immunological phenomena. Here, we are going to represent what is Roth spots. Let's suppose this is the retina. And these are the hemorrhagic spots in the retina, which are present in the infective endocarditis. We can find it out through fundoscopy. These are the Roth spots, which are important findings in infective endocarditis. Now, what are Janeway lesions? As we discuss, these are the hemorrhagic spots in the palms. These are the hemorrhagic spots, but they are painless. There is no discomfort. They are called Janeway's lesions. Now, as we discussed, what are ossular nodes? Painful nodes, which can be pinkish with paler center, present in the finger pads, and they are painful. Very important finding during the clinical examination of a patient of infective endocarditis. It's called ossular nodes. And splinter hemorrhages, which are small hemorrhages present under the nail. Very important finding again during the clinical examination. As we discussed, there can be glomerulonephritis, which is inflammation of the glomeruli, which is an immunological phenomenon present in a patient with infective endocarditis. This inflammation is the graphical representation. So it is the glomerulonephritis. Thank you so much for watching and listening.